What is black fungus or mucormycosis? How to survive? Black fungus directly affects the sinuses, brain, and lungs and can put people with cancer or HIV/AIDS at risk of life-threatening diabetes, including people with severe immunodeficiency. The spores of mucormycosis can be found in soil, air, and even in food. However, they have low pathogenicity and rarely cause disease. Before COVID, there were only a few cases of the disease. A considerable number of instances are now being recorded as a result of COVID, he remarked during a press conference. Many individuals recovering from COVID-19 have recently been diagnosed with black fungal disease, also known as mucormycosis. The fungus spreads through the sinuses and into the intraocular and brain regions. Patients may die in 50 to 80% of cases if the disease goes undiagnosed. Doctors feel that steroids, a life-saving drug for critically ill COVID-19 patients, can trigger mucormycosis, which has an overall mortality rate of 50 to 100%. Steroids reduce inflammation of the lungs and help reduce damage caused by overdriving the body's immune system against the coronavirus. However, they reduce immunity in diabetics as well as non-diabetics who have COVID-19 and increase blood sugar levels. These instances of mucormycosis can be triggered by this decline in immunity. Mice and rabbits have been tested for rapid killing of inhaled spores by white blood cells in healthy animals. But the body produces fewer white blood cells if the host's immediate response is suppressed. In this condition, the spores germinate and rapidly develop into small, wire-like tubes, which penetrate the blood vessels and destroy them. Where black fungus does more attacks. Mucor invades the sinuses and spreads to the lungs, brain, and central nervous system. Fever, headache, red and swollen skin near the nose or eyes, facial discomfort, coughing up red or black discharge, and shortness of breath are common symptoms of subsequent mucormycosis. A tissue biopsy and an X-ray scan of the lungs can help doctors identify it. Mucormycosis can damage the face, infect the nose, eye orbit or brain, resulting in visual loss. It has the potential to travel to the lungs. Why black fungus infection occurs, causes. Overuse of steroids is a key factor in the development of mucormycosis. Black fungus, people who can be at high risk from this infection. Prior to COVID, this condition was found to a large extent in diabetics, transplant and cancer patients, but it was uncommon in the general population. A substantial number of cases have now been reported as a result of COVID therapy. How to avoid black fungus? To avoid black fungus infection, physicians treating COVID-19 patients, diabetics, and people with impaired immune systems should advise against symptoms such as sinus trouble or nasal blockage on one side of the face. Unilateral headache, swelling or numbness, toothache. One should look for early signs.